My name is María Yoldi, and I am presenting the video abstract in name of my colleagues for our article entitled Cognition in Euthymic Patients with Bipolar Disorder. Don't forget to account for anxiety. This study was done at the National Institute of Psychiatry in Mexico City. Bipolar disorder is characterized by severe mood instability. It affects 1 to 4% of the population and is highly disabling. It is the fifth leading cause of disability. This disorder is accompanied by cognitive deficits which vary in severity, despite being in euthymia. Several factors are related to these deficits and should, therefore, be systematically evaluated when studying cognitive symptoms in this population. On the other hand, anxious symptoms, whether part of comorbid anxiety disorder or independent, are highly prevalent in persons with bipolar disorder and are risk factors of various poor outcome measures. Furthermore, anxiety, on its own, is associated with diminished cognitive performance in cognitive tests in some people. Our research question was therefore the following. Does the severity of anxious symptoms affect attention and/or inhibition of cognitive interference in euthymic patients with type 1 bipolar disorder? To answer this question, we evaluated 87 euthymic patients with bipolar disorder from the outpatient clinic to obtain the following variables. Our main finding was that the inhibition of cognitive interference is associated with the severity of anxious symptoms, the severity of cognitive complaints, and years of schooling. Furthermore, anxious symptoms and cognitive complaints are highly correlated. The inhibition of cognitive interference was evaluated with the Stroop test. This test involves looking at words naming colors printed in different colors from the ones they name. For example, the word red is printed in blue, and the person must inhibit the impulse of saying red and answer blue. This is very difficult. Anxious patients with cognitive complaints might be more focused on monitoring their performance than on the task itself. Indeed, research has shown that participants with higher emotional acceptance and lower performance monitoring attain higher scores in the Stroop test. Our results highlight the need for routine evaluation of anxious symptoms when screening for cognitive decline in bipolar disorder and invite future research on the possible impact of interventions directed at anxiety symptoms for cognitive rehabilitation. We hope you found our study interesting. Thank you for watching.